I'm going to talk about my paper, which is named an Ambient Medication Display to heighten the peace of mind of family caregivers of older adults, the study of feasibility. The topics that I'm going to mention are an introduction to the problem domain, an explanation of the medication ambient display we developed, the study design, results, conclusions, and future work. Medication is an activity of daily living which, if not done properly, can affect the quality of life of older adults. It is estimated that from 29 to 50% of chronically ill older adults do not adhere to their prescribed medication due to forgetfulness. Successful adherence involves multiple cognitive processes which are vulnerable to failure, causing the forgetfulness, and which are associated with prospective and retrospective memory. Prospective memory allows us to recall actions that we want to perform in the future. For example, an adult that remembers that he has to take his medication at a certain hour of the day, while retrospective memory allows us to remember events that took place in the past. For example, an adult that wants to remember if she already took her pills. Since prospective memory allows us to remember all the activities we need to perform during the day, problems with it cause problems in the basic and instrumental activities of daily living, which increments the caregiving demands. Older adults' family caregivers face an emotional burden as the dependency of older adults increments, which can also affect the caregiving quality of life. Several interventions have been recommended in order to help the older adult to conduct his medication activity, and most of these interventions are already supported by a technology. For example, most adherence technologies are time-based reminders, which tend to focus on reminding the older adult to take their medications on time. On the other side, most research in adherence technologies don't take into account daily routines and events, which have been identified as important contextual cues when the patient learns to associate them with the medication intake. It is recommended for the older adult to link his medication with daily routines, for example, to take medications when waking up, with breakfast, or before going to sleep. And it is also recommended that he perform an action or event after the medication intake, since this action can help him to remember that he medicated correctly. There are also monitoring interventions for which technologies such as MedTracker and NEMS have been proposed to enable patients to track their medication. And ambient computing has focused on motivating the older adult to follow their medication regimen, which we have, for instance, MobiPill, which is a mobile phone application that gamifies the medication activity by awarding adherent users and by promoting a social competition. We concluded so far that these ambient computing technologies have been assessed for improving the older adult's medication. However, their impact on the family caregivers has not been assessed. Also, these ambient technologies have not been studied about how they can support the medication activity and link them with the medication activity with the routine. So we saw as a research opportunity to assess the potential of ambient computing interventions to allow us to study this research. So to read this end, we are using as a research test bed design of an ambient medication display that we have previously designed. The purpose of our ambient medication display is to improve the older adult's medication and also to support the caregiver role. It was implemented for Android tablets, and it was placed in the older adult's home as a portrait. An ambient display presents useful and relevant information to users in an unobtrusive way by using ambient modalities. In our case, our ambient medication display uses three kinds of ambient modalities. It has auditory notifications to call the older adult attention when it is time for him to medicate. It has pictogram space notifications, which represent critical information of the medication regimen, and it has abstract representations of the medication taken. Our ambient display shows a virtual cage of birds, which has the aim of raising the older adult's consciousness about how they have to take the responsibility for their own medication in a similar way that they gladly take care of their pets. The pet and its growth represent the daily medication compliance, and it presents daily feedback to the user as every day it begins as an egg. And as the older adult starts to medicate correctly, changes are observed in the growth of the pet and incentives start to appear in the cage. Also, by taking into account the growth of the pet at the end of the day, the older adult can realize if he medicated correctly or not. Once it is time for the older adult to take his medications, the parakeet, the bird, begins to whistle, and the visual reminders appear on the ambient display. This presents critical information about the medication regimen, which includes the name of the medicine, the health problem addressed, the dose, an image related to the medicine, and the time to take the medication. Once the older adult takes the pills, to register the medication intake, he should approach the pill container to the ambient display, which is recognized or detected by near-field communication technology. Also, at any time of the day, the users, even the older adult or the caregiver, can consult a medication taking report that shows information of the medications that have to be taken in that same day, and it shows if they were already taken, if they were omitted, or if they are still pending. We conducted a feasibility study with the main objective of assessing the utilization and acceptance of our ambient medication display to support the medication in older adults and also the caregiving role. We have two specific objectives, which are to identify system usability problems and also to identify design features that will help us to associate medication with daily routines. To help us reach these objectives, we base our study in a case series study, which has the characteristics that it includes 2 or more cases, and it is used for different reasons, such as identifying trend analysis regarding outcomes, and it is also used as an initial report of a new intervention of treatment, which is our case. But as it is a qualitative study, it does not conclude regarding intervention effectiveness. Our study consisted of 3 phases. The first one was recruitment, which lasted 4 weeks. During these 4 weeks, we interviewed 8 diets by using validated instruments and as an instructor interview. 2 older adults were taken into account in our study, which had more than 65 years. They had mild cognitive impairment, polypharmacy, and also a caregiver was concerned about their medication. We took into account adults with mild cognitive impairment to be sure that they had memory problems, but however, according to medical literature, they are still capable of performing their daily life activities. The second phase was pre-intervention, which lasted 2 weeks. During this time, we asked the caregiver to answer a daily survey, which made questions about the older adults' medication problems, reasons for which they might not have taken their medications, the assistance they provided to the older adults when they were medicating, and if they feel worried about the seniors' medication take. The last phase was intervention, which in here we first trained the older adults and the caregiver so that they could learn to use our system. We then placed the ambient display in their home as a portrait, and they used it during 4 weeks. In this time, we conducted weekly interviews to know problems faced for using the system, and also to know which system functionality they perceived as more and less useful. We also asked the caregiver to continue to answer the survey of the pre-intervention phase. Okay, this table is a summary of the 8 diets that were interviewed. Only diets 3 and 5 were taken into account in our study. In the 3rd diet we interviewed, the older adult was 82 years old. Her name is Rosie, and her daughter is the caregiver. Rosie takes 7 medicines for diabetes, hypertension, and glaucoma, and she associates most of them with daily routines. In the 5th diet we interviewed, the older adult was 69 years old. His name is Ruben, and his wife is the caregiver. Ruben takes 10 medicines, most of them for blood pressure and chronic pain, and his wife usually reminds him to medicate on time. This table represents the system functionalities perceived as useful for supporting older adults and caregivers. In the case of older adults, they perceived that the most useful functionality was the auditory reminder. About this, Ruben commented as follows: "Before using the system, I used to skip the doctor instructions. Now I obey the system and I feel more supported." case of caregivers, the most useful functionality for them was the medication taking report. About this, Rosie's daughter commented, "If I don't check it in the morning, I check it in the afternoon, and now I don't have to ask my mom about her medications." Also, most usability problems were related to the medication registration functionality. This was because some of the near-field communication tags stopped working, and we had to immediately replace them. With the answers given by participants for explaining the system functionalities, we could identify the benefits of using our system, which are that older adults became more responsible and independent for taking medications. About this, Ruben's wife commented that the system reminds him that he should not take his pills for pain relief before the parakeet whistled. Also, the involvement of relatives that were not the primary caregivers was increased. About this, Rosie commented us that her grandkids that usually visit her started to be aware of the ambient display, and they wanted to use the tablet to register the medication in order to see how the pet grows. Also, the peace of mind for primary caregivers increased. This was because they felt calmer since the ambient display helped the older adults to medicate on time. We also received several suggestions from the caregivers about how to improve the system, the ambient display. They wanted the display to provide historical reports of the medication compliance. Rosie's daughter told us that she wanted to be able to consult her mom's compliance of any day in the past, since sometimes she wasn't able to visit her. They also wanted the system to remind to execute daily routines relevant for older adults' medication taking. This was important for Rosie because she needed to eat at a certain hour of the day so that she could medicate afterwards as prescribed by the doctor. So her daughter suggested that we should remind her to make her meals on time. Also, both older adults and caregivers suggested to enhance the auditory modalities of the ambient display. This was because they wanted to be able to hear the reminder from any place of the home. These graphics represent the percentage of pills taken over pills expected to take during each of the weeks. We can see that Ruben took almost all of his pills, getting 100% the third and the fourth week, while Rosie didn't perform so well in the third week. We think this is because her daughter injured herself that week and she wasn't able to visit her mom to remind her to take her meals on time so that she could medicate correctly. When taking into account the percentage of pills taken inside the prescribed time window, we can see that Ruben adherence went down. This is because he tended to medicate before the prescribed schedule, which was something that worried his wife, even though she told us that the system helped to prevent this problem. We can see that Rosie graphics stayed almost the same. This is because she waited for the auditory reminder to the ambient display to remind her to medicate on time. As conclusions, overall experiences were consistently positive, even though some usability issues were also reported. With the feedback we received from participants, we were able to identify new system requirements, one of which was to facilitate the older adults to associate their medication with critical daily routines. We are also aware that it is important to assess the effectiveness of our system. So, as ongoing and future work, we have currently recruited 20 diets of adults and caregivers who are going to take part of a randomized control trial. Thanks for your attention.